All right, let's begin. I will call this meeting to order. Welcome to the Grey Roos Board of Health meeting for Friday, August 26th, 2022. We'll start with the roll call, please. Mary?
Sue Patterson,
Present?
Alan Barfoot,
Present.
Brian Mills,
Present.
Brian O'Leary,
Present.
Chris Peabody, census regrets, Luke Charbonneau.
Here.
Selwyn Hicks,
Here.
Helen Claire Tingling,
Morning, Mary.
Janice Jackson, Nick Saunders,
Thanks, Mary. We do have a quorum. So we'll start with item 2, amendments to the agenda. Are there any amendments from anyone that they would like to add something or remove something from the agenda? Seeing none, I will ask for approval of the agenda. I need a mover and seconder. Brian O'Leary and Brian Millen, all in favor? That is carried. And I will ask if anyone has a disclosure of pecuniary interest or a conflict of interest. Again, seeing none, if one should arise during the meeting, you may declare it then. So item 5 is our educational notes, and keeping with the theme of professions in public health, we're going to highlight nursing. So the Nursing Act in 1991 and the Regulated Health Professions Act of 1991 govern how the nursing profession is regulated in Ontario. Since 2005, all Ontario nurses must graduate from an accredited nursing diploma, practical nursing or degree, which is bachelor's nursing program, to qualify for their respective registration exams. To register as a nurse in Ontario, applicants must meet the nursing educational requirement, provide evidence of nursing practice, pass the National Registration Examination and Jurisprudence Exam, and meet criteria related to language and citizenship authorization under Canada's Immigration and Refugee Protection Act. In Ontario, the College of Nurses of Ontario provides these standards to ensure all graduates possess the core competencies required to begin working as a nurse. There are a total of 101 competencies organized into 9 key categories, which are clinician, professional, communicator, collaborator, coordinator, leader, advocate, educator, and scholar. Individuals who complete the practical nursing program and pass the Ontario nursing exam are designated as registered practical nurses, while Bachelor of Nursing graduates who pass their exam are designated as registered nurses. You'll see letters behind their name that say BSN and RN. When hired by a public health unit, these RNs acquire the designation of a public health nurse, which is PHN. To maintain registration, all nurses must maintain good standing with the College of Nurses of Ontario. They must renew their membership annually and participate in all components of the registration renewal process, including reflective practice. Public health nurses promote and protect the health of individuals, families, and communities. They also collaborate with the larger community to plan, develop, implement, and evaluate health promotion and protection programs provided by their respective health units. Key areas of responsibilities that guide a nurse's work in a health unit include communication, assessment and analysis, policy and program planning, implementation and evaluation, partnership, collaboration, and advocacy, diversity and inclusiveness, public health sciences, leadership, ethics, and professionalism. Quite an extensive list. Nurses at the health unit play key leadership roles in many teams' successes, including school health, vaccine and preventable disease, infectious disease, sexual health, harm reduction, smoking cessation, healthy growth and development, healthy babies, healthy children, infection prevention and control, and health equity, which is social determinants of health. Nurses are critical team members when working with groups of external partners, including school board, police agency, municipality, county, health and social service partners, hospital partners, long-term care and retirement homes, congregate settings, and government agencies. So when you see a nurse, there's a lot going on behind what you're actually seeing when you just meet a nurse. Quite a list of examinations they need to keep up to date, and their role in the health unit is very, very important. Is there any discussion with nursing? Any comments or questions? Okay, seeing none, we'll move on. Thank you. Item 6 is adoption of minutes. So we have minutes from the board health minutes from July 22nd, and I need a mover and seconder. Al Bartlett, and I see Helen Clare. Is there any discussion with those minutes? All in favor? That's carried. Thank you. So we'll move on to correspondence and news releases. We'll start with correspondence and Dr. Eric.
Thank you, Madam Chair. We have 3 correspondence on the list today, and the 3 of them come from one of our region. The first one is related to employer paid sick days in Ontario. And the board in Niagara called on the provincial government to examine the extension of the 3-day sick paid. So it's employer paid sick days as a measure to control or to help control the pandemic, to reduce transmission, where people would be able to take sick leave and not go to work and contribute to transmission. They call on the government to look at the Canada Labor Code that provides 10 paid sick days. Madam Chair, I looked at whether we should endorse or receive, and definitely helps with transmission. The fact that we're on the tail end of the pandemic, this measure might not be as significant. Looking at the fact that it's related to different ministries, other Ministry of Health only, and it might entail multiple levels of examination, that it's not only related to health. I'm divided between receive or endorse, so I like to urge the board to as always to make that decision.
Any discussion? Whether we should receive it or endorse it? No?
Well, I mean, doesn't refer to the board, that's what she was, yeah, that's fine. You want their expertise on this, and they're willing to live
More words?
in the door.
Okay. All right. So Al and Brian and Leary move in second to endorse number 1 and 1 on the correspondence.
I see a note about the quality of voice. Can we can check if the other members can hear us.
On screen, sorry, on the Zoom call, can you hear me? Okay.
We can hear you okay, Madam Chair, but Dr. Eyre is pretty hard to hear for some reason, and some of the other board members.
Okay.
Okay.
We'll try and speak louder.
Madam Chair, I believe the camera focused on one person and based on the voice from there, so I probably look at the camera that just acknowledge it.
Okay.
The second item is Board of Health, Niagara region also is related to endorsing different members' recommendation to address opioid crisis, similar to what other health units put forward, and it is reaffirmed that many boards have put this as a new letter, not just as endorsement. But since we have already issued this documentation for such correspondence, my recommendation is to receive. The last one is also the same board. It's a letter to the Minister of Health and the Deputy Premier of Ontario, and related to funding for public health and the fact that there has been inflation, there has not been increase to the funding in public health as a sector for the past 2 years. And my recommendation is to strongly endorse this item and share.
Is there any discussion with these items, the correspondence items? Helen Claire?
Thank you, Madam Chair. Through you, I recognize it's been a relatively short time since the provincial election, but I also recognize the opioid crisis has been a front burner from the beginning of the year. I wondered if there has been any response or indication of an upcoming response from the province. I wondered if Dr. Ara could speak to that. Thank you, Madam Chair.
Through you, Madam Chair, there has not been a correspondence response to our board or other boards that I've seen directly, but we've seen multiple fronts have been moving, whether it is through Public Health Ontario, World Group Focus. One of the subgroups is led by Dr. Cihr and co-led by Dr. Cihr. As one example, but not specific direct correspondence to the board office.
Dr. Zaya, did you want to comment or you will have an update?
No,
during
I
your-
can just add a comment specific to that, through the group, the working group with Como, we know that the letter was received by the ministry, like the letters of similar to the letters that were sent by the board. So the letter was acknowledged as received. So there is probably a process for a response like this.
Okay. Good. All right. So we have, and I will ask the mover and seconder if you will allow you've already moved and seconded item 1, item 3 to endorse with that. Can we include that with your motion to endorse?
Yes.
So we have a yes from the mover and seconder. So all in favor to endorse item 1 and item 3. That is carried. And I need a move, we'll wait and receive the second one with the media releases. So that motion is carried. So we'll move on to news releases, and I see Denise on the call. Please
Yes.
go ahead, Denise.
Thank you, Madam Chair, and through you, today's agenda contains 13 news releases. Between August 4th and the 19th, 3 news releases were distributed after opioid alerts were issued to system partners, each regarding several reported overdoses within a short time frame. None of the overdoses were fatal. The news releases included harm reduction information as well as addiction services resources. There were also 3 news releases between July 22nd and August 3rd regarding separate dog bite incidents. These releases sought the public's help in finding the dog's owners to confirm they were not infectious. The dogs were not infectious with the rabies virus. And awareness news releases issued in late July and early August, including one on International Drowning Prevention Week and another on preventing potential rabies exposure. On July 10th, Public Health issued a news release on plans to hold bi-weekly, by-appointment monkeypox vaccine clinics until further notice. Individuals can visit the Grievers Health Unit's website for eligibility and clinic information. The Health Unit also issued a news release to highlight the dedicated and collaborative efforts of the Peninsula Family Health Team to achieve exceptionally high COVID-19 vaccination rates among their patient roster and efforts to safeguard their community during the pandemic. And other news releases in today's agenda include one on the reopening in mid-July of the Grievers Health Unit Sexual Health Clinic, another on public health providing lower dose pediatric COVID-19 vaccines to children aged 6 months to 5 years at its clinics, and another on deceased Cooper's hawk found in Lion's Head, which tested positive for West Nile virus. And that release included information on the virus, how it spreads, and ways for people to protect themselves. And that concludes the media release summary report.
Thanks, Denise. Is there any discussion or comments, questions? Helen Claire?
Thank you, Madam Chair. Through you to Dr. Ara, with regard to the West Nile virus, just wondering his opinion on how it looks to be this year in comparison to other years. Thank you.
Through you, Madam Chair, the surveillance for this disease remains very low risk. The number of detected cases is very low, and again, it's not in humans. That has been consistent. I don't see it even changing in a few years coming forward.
Very good. I don't see any other hands raised, so I need a mover and seconder to receive item 2 in the correspondence and the 13 news releases as presented. I have Luke moving it and Helen Claire second. All in favor? That is carried. Next on the agenda is a staff presentation, and we have a senior public health manager speaking about school health program update. Dr. Aaron.
Through Madam Chair, just to introduce Cihr, we have been very well served by his interest in our health unit application and recruitment. Cihr has a background as a dentist, who during his practice, I had a couple of chats with him how he got introduced to public health. He saw the light of preventing much more disease instead of dealing with the clinical aspect after the fact, and he has training from the UK in public health. He worked in a number of health units in Ontario, and he joined our team in this past year. And look forward to this presentation and the great work he's been doing.
Thank you for the introduction and welcome, Cihr. The floor is yours.
Thank you, Madam Chair, and good morning to members of the board. Today, I'll be presenting an overview of the school health team. I would attempt to share my screen. Just a sound check. Hope everybody can hear me okay.
Yes, we
Thanks,
can.
guys. Once again, thank you for taking the time to meet with me today and give me this opportunity to present an overview of our school health programs. For today's presentation, I'll be talking about the team that works within the school health team, provide an overview of some of the programs we deliver in the school health program, things like the school health promotion and well-being, mental health promotion, curriculum support. Then I'll equally provide a bit of a proposal of 2 upcoming programs we're hoping to implement this new school year. So for our team, we have a team of 6 public health nurses, 1 program assistant, and 1 health promoter. As members of the board will recall, Grey Bruce Health Unit did get 9 school-focused nurses through the funding from the province. Of these 9 school-focused nurses, we have 3 who are permanently within the school health team, and the other 6 are working in other programs within the mandatory program. So that's why we have 6 public health nurses on the team. This team supports the Blue Water District School Board, which has 49 schools, as well as the Bruce Grey Catholic District School Board with 13 schools. We support 1 school, which is the French Catholic School Providence School Board, has 1 school which is supported by the team. We're also supporting 1 First Nation school and a number of other private schools. So for an overview, and I will speak to these in details in the accompanying slides, but just to provide a quick rundown, I'll be talking about the school health promotion and well-being. I'll be talking about what we are doing in mental health promotion, what we are doing in curriculum support, as well as the proposed mandatory funded programs we are looking to start this next school year starting in October and November. So for the school health promotion and well-being, we work with the different school boards using different approaches. One of the approaches we use is partnership. So we partner with the boards of education and schools to offer evidence-informed public health programming that address the health needs of the schools and the students. We achieve this by regularly reviewing the data we get around emerging issues and trends within the health of school-age children, and then propose public health interventions to the schools and work closely with them to try and implement these interventions. An approach we also use is called the Healthy Schools approach. This is an internationally recognized approach that supports improvements in students' educational outcomes while addressing school health in a planned, integrated, and holistic manner. Then also, we support the schools with COVID-19. We are still in the pandemic, so we still help the schools with planning their different responses to COVID outbreaks, providing advice on policies and procedures to implement within the schools, and also helping with advising parents, answering questions, and doing IPAC assessments within the schools to ensure that any situations around the pandemic are properly managed. For the mental health promotion, we do have within the schools two programs that we implement. The first one is the Youth Mental Health and Addiction Champion Project. What this project does is it identifies mental health champions within the schools, among the students in the schools, and these champions are trained to be able to intervene with their peers. So it uses a peer approach in delivering this youth mental health and addiction program. I would like to add at this moment that this project is funded in part by the Registered Nurses Association of Ontario. Another program we implement in the schools is called the Roots of Empathy program. This is another evidence-informed classroom program for grades K to 8, which is designed to raise levels of empathy, resulting in more respectful and caring relationships and reduce levels of bullying and aggression. The program resources we use to implement this program are supported by the Roots of Empathy organization. We also support the schools with curriculum support. What we do is, because the schools tackle a number of health issues, they do reach out to us to provide some subject matter experts in different areas: smoking, physical education, nutrition. So we do support them in developing curriculum to be able to address this in the classrooms. So like I said, we do it through development and implementation of health-related curricula, assisting in evaluation of evidence, assisting in development of policies and resources, and facilitating and training educators and students on these different health-related topics. Then we'll be moving into the new programs we hope to roll out this next school year. In rolling out these programs, we are taking our cue from the strategic plan framework. We are using an approach that cuts across the lifespan of across the total lifespan, right from child, youth, and even seniors' health. We're using that approach to address determinants of health inequity, and be able to be in a good position to respond to emergent and urgent public health issues and public health priorities and the needs of the vulnerable population. For the programs we have upcoming, we have focused on the areas of the people, the programs, and partnerships. So these are the areas we're focused on as we develop these new programs we are planning to implement this next school year. And our strategic goals that we hope to achieve with these programs are to improve the health through reducing preventable diseases and injuries, and to optimize healthy human development. So the first program we are planning to roll out is called the School-Based Health Clinics. And the goal of this program is to increase youth access to health education and health services. The services we hope to offer include health education around different topics such as mental health and well-being, tobacco and vaping cessation, and healthy relationships. We also hope to provide harm reduction supplies such as condoms, pregnancy tests, and naloxone kits. Then another service which is equally important is health system navigation and referrals. So to just describe what we hope to, how we hope to implement this program, we hope to have the public health nurses schedule 1 day a week in the high schools where they are available to meet with students on an appointment basis and hopefully offer these services to the students when they do get that opportunity to. This is a snapshot of the logic model that we're using to implement this program. We have our short-term outcomes that the youth have confidence and understanding on how to assess the school health, public health, the public health nurse within the school health clinic. Our long-term goal is that the youths are able to access appropriate and timely health services for their needs, either through their GP or through the family health teams. And we hope that with the implementation of the school-based health clinics, we'll be able to reduce incidence rates of sexually transmitted infections and bloodborne infections as well, and also reduce the rate of unplanned adolescent pregnancy. Like with every new program, it's imperative that at the beginning of planning the program, you do put in place an evaluation framework. The essence of this is to be able to look at your program as you're implementing it. Excuse me. The objective behind this is to be able to put in place processes that will enable you monitor and evaluate your program so that you can, at the end of the day, see if your program is meeting its objectives. If it isn't meeting its objectives, find ways to tweak the program and see if those objectives can be made. But the objective, the overall goal here is to constantly improve on what you're delivering. So we have, right from the beginning, have an evaluation framework for the school-based health clinic so that we are able, throughout this next school year, to constantly review the program and be able to make adjustments as we go along, ensuring that we are meeting our set goals. The other program we hope to start in the new school year as well, and we hope to launch this in November. Forgive me, we're hoping to launch the school-based health clinics in October. Then the vision screening program we hope to launch in November. So for this program, we're offering vision screening to SK students. It's known that vision impairment could go undetected in early childhood. And it's also known that a number of children do not receive regular comprehensive eye examination from optometrists. So we are hopeful that offering this vision screening program will help us identify the children with some identified impairment, and also be able to recommend those that should access the services of an optometrist for a comprehensive eye examination. This also is the logic model we use in the development of the program. Our long-term goal here is to have healthy child growth and development in the absence of vision problems. So with that, I just provided a quick overview of the team. With that, I am able to answer any questions members of the board will have with regards to my presentation. Once again, thank you for taking the time to listen to me.
Thank you, Cihr. Very good presentation, and I'll ask the board members if there are any questions or discussion. Al?
Thanks, Madam Chair. It's a great presentation. The question then regarding, we're looking at doing vision screening and SK coming forward. Is there anything in place today where any vision screening has been done up till now in the past?
Through you, Madam Chair. Thank you, board member. And please forgive me. I didn't provide all the information. I kind of forgot a very critical part of the information. You are right, board member. Before the pandemic, we had piloted the vision screening program, and but the pandemic came, hit, and it put everything on hold. So we are hoping it's really a restart. So we're hoping to have a restart of the vision screening program, and we are partnering with the Lions Club at District A19 to implement this program. So that's the plan we have. The way we have planned the vision screening program is the health unit will do the pre-screening work and the post-screening work, while the volunteers from the Lions Club will do the actual screening in the schools. So that's how we hope the partnership will work. So yes, there was a pilot before the pandemic hit. This is more like a restart. I apologize for not providing that piece of information. I hope that answers the board member's question.
It does. I guess just a follow up again, Madam Chair. So the kids that missed the last 2 years, then will they be able to be have the screening in the future then?
Through you, Madam Chair, no, we do not have any plans to do a catch-up for those students that missed the last 2 years.
Dr. Aaron?
Through you, Madam Chair, thank you, Cihr, for that information. I echo all of it. I can add to it the screening of vision is new to public health, was added to requirement in 2018. And because of the announcement of amalgamation, several health units, anecdotally, I would say 50% did not proceed with that testing. What we did was a pilot to see, is this gonna produce benefit to the community, or is gonna produce false positive and most importantly false negative, and in that to actually produce positive results when the child does not have any problem. It's gonna create so much anxiety and so much resources to follow up with that kid, and most importantly, false negative. A child that has a vision problem, if there's screened and the screening didn't pick up the problem, that's gonna be detrimental to them, because it's gonna be reassuring, false reassurance. So we did the pilot, and if the test was not done through an optometrist, it is expected to have lower reliability of tests, and that's what actually we found, and we provided this to the ministry at the time. Several other health units went the same route to actually utilize testing that happens in the community through Lions Club or other clubs. As a result, if this is mandated, we'll proceed with it. If it's not, obviously it's left in the hands of people who do it best.
Thank you. Selwyn?
Thank you, Madam Chair, and thank you to Cihr for that presentation. My question, Madam Chair, is with respect to the Youth Mental Health and Addiction Champion Project. That's a mouthful, isn't it? I wonder if you might dig a little deeper. Tell us more about what specific training the young people receive and what activities they engage after their training, how many, and the success of this program.
Thank you. Through you, Madam Chair, to board member Cihr. So the public health approach we use, like I mentioned, is the peer-led approach. So we work with the mental health coordinators in the boards, and we identify those youth champions within the schools. Now, those youth champions participate in training, half-a-day training, provided with the tools and resources with which they will use and form different groups of their peers, and they do different games, they do different interventions, have different courses or seminars to be able to identify ways to improve resilience. So it's it's a program that is designed around and is youth-led to find the ways to be able to, if there's an issue, to be able to talk about these issues in their own language and in their own vein. There has been a number of evaluations that have been done and have shown that these programs have been effective in reaching students through this method. What I could provide to the board member is I could go back and dig up those interventions and be able to present at a later meeting or pass it along to the board. But I don't have that information to the questions about the evaluation with me at this moment.
And, Madam Chair, I'm assuming that the young people are able to use the hours that they're involved in this leadership project towards the hours for volunteerism for high school.
Through you, Madam Chair, I would expect that that's will be the case, but can I get back to you on that question then?
Of course.
Very good. Brian Millen.
Thank you, Madam Chair. Thank you for the presentation, Cihr. Under the school boards and various other schools that you show supported, you listed other private schools. Does that include the Mennonite and Anabaptist community?
Yeah, so we have 31 private schools, and we have what we call through you, Madam Chair, to board member. We have on our list 21 private schools and 34 seasonal schools, which include the Mennonites and the Baptist schools. Yes, it does.
Excellent. Thank you so much.
Okay, any other comments? Luke and then Helen Claire.
Thank you, Madam Chair, and thank you for that presentation. It was really interesting. I'm interested by these in-school health clinics that you're looking to start establishing in October, you said, and you're talking about having a public health nurse in each school 1 day a week. I hope I understood that correctly. That's a lot of days. That's a lot, because you were just, I saw over 60 schools you listed in the list that you had on there, plus these private schools. I mean, we're talking dozens and dozens of schools, which means dozens and dozens of days a month of public health nurses in schools. So I just wonder, maybe you could just drill into that a little deeper. How do you achieve that? Seems like a really big undertaking.
Through you, Madam Chair, to board member Luke, we were focused on the high schools for now. So it's the high schools, and I could get the numbers for you. So the plan is to have the nurses within the high schools and implementing this program. So it's not all the schools, it's just the high schools the focus will be on.
How many, sorry, Madam Chair, how many schools is that? Any idea?
If you could, through you, Madam Chair, if you could just give me a second, I could just get the numbers for you.
I can hear the music from Jeopardy in my mind.
If it's a big undertaking, it isn't a big deal.
No, it's not a big undertaking. So we are looking at between 12 to 15 schools. Yes.
Okay. And so you have the capacity, the existing public health nurses, and to do that. That's because you're talking then 15 days a week, right? When however many nurses that takes to do. So I guess that's still, I mean, a lot of new work, and you guys have the internal capacity to carry that off.
Yes, through you, Madam Chair, to board member Luke. Yes, so we're talking about each nurse has about 2 schools. So that'll be two days a week. Now, there are some schools, for example, the school from the Providence, the Catholic French Catholic. It's a smaller school. So we've had conversation. We might not have to go there every week. It could be every other week. But yes, on the average, it will be 2 schools for each nurse, and there will be we believe there will be capacity to deliver that program.
Very good.
Thank you, Madam Chair.
Dr. Era, just before Helen Claire, Dr. Era.
Certainly. Thank you, Madam Chair. To add to that, there is always something that can come up, whether it's COVID or other undertakings. So we have the other 6 nurses in other programs who have recent experience with the school programs. So we can redeploy and address those issues that require increased capacity as we go. It's not just concrete in the way it is.
Very good. Helen Claire.
Thank you, Madam Chair. A few things to say. First of all, I just love these presentations, and I can see that my colleagues, we get so much out of them. And to this particular presentation, Cihr, thank you so much for your grace. We're firing all kinds of questions at you that you weren't expecting and reasonably shouldn't be expecting, but we are, as you can see, a really super engaged board. 2 topics I'd like to have some clarity on. I'm really pumped to hear about the youth mental health and addiction peer project. That's wonderful. How old are these kids and how are they selected?
So thank you, Madam Chair, to a board member. So these kids, it is in the high school as well. So there is a criteria to use for selecting these kids. They would be selected by their teachers, students who show some leadership abilities, who show a extreme interest in these programs will be selected to act as champions. Now, when they are selected, the team does meet with them too, to have a better understanding about their motivation and find out if they are the fit to be these champions. So they go through a number of selection processes to, first of all, they get nominated from their schools, maybe through their teachers. Then they meet with members of the team, and there is another review to just ensure that they are the right fit for the program before they are taken through the training purposes. So those are some of the phases they have to go to. So most of the program we deliver is in the high school. So these are kids in 9 to 12 as well.
Thank you, Cihr. And the next thing around that same topic, the roots of empathy, I believe, is when mothers are taking babies into the elementary school. Is that the same one? What an incredible idea that is, and how wonderful to have both of these to help young people. I'd like to move on now to the part of your presentation that talked about the strategic plan framework. In particular, the approach was to improve maternal, child, youth, adults, and seniors. I'm wondering if there is a plan to integrate men into these programs, not just for its own sake, for the sake of inclusivity, but also it would seem to me important to positively engage men in early childhood care of their children as part of the family unit. It may also help counter domestic violence. And of course, there are more and more children now being raised only by men. That's a significant group. And yet in the approach slide, I noticed that men were kind of seem to be left out inadvertently. Of course, they're covered up in adults and seniors, but I believe, Cihr, you'll understand my point about inclusivity and specific outreach to this demographic. I wonder if it's not unfair to put you on the spot, if you're able to speak to that, or perhaps Dr. Ara can. Thank you.
Right, thank you, through you, Madam Chair, to a board member. You are right. When programs are delivered, when programs are developed and planned, they are planned across to the group most in need. In the way our programs are planned, our focus on target population are the students, and we would focus on the child and youth. But definitely, you're equally right in saying that this probably would be a very good question for Dr. Arad and Dr. Zaya to respond to effectively.
Dr. Ara.
Thank you, Madam Chair. Thank you, Cihr. So the program itself is it's an international program that is adopted. So that's how it was designed that is not to say that it cannot be evolved locally and advanced locally. And I do appreciate Helen Claire's input there. Raising a child is a combination of many aspects of childhood development, and having that aspect introduced would benefit, I believe, the students on multiple levels as well. And it is something we will look at, something we'll explore if somebody developed that aspect of the program that we introduced the way it was designed. Something for us to strive to improve.
Helen Claire, response?
Just, oops.
So you're on mute, Helen Claire.
Thank you. Just to say how very much I appreciate that. You know, through gender-based analysis, we do find biases, and in this case, I do see one. I'm aware, for example, of a young woman who wanted to attend. This is historic, so just to let you know, it's not right now. Some years ago, wanted to attend prenatal classes, and they were at a particular time, and her husband was not available at that time. There was another series of classes, and they were only available. They were available in the evening. Her husband could attend that, but wasn't allowed to because they were only for single mothers. So that meant that that particular individual wasn't able to get what she needed. There was no program. I'm saying she, and yet it was the whole family. Here we are fast forwarding, and the demographics that I've spoken to, the fact that there are more men raising families without women, and because it's new in our society, we perhaps don't even have the traditional hand-me-down knowledge and wisdom that can go to those men. And I very much appreciate the openness to dialogue on this, Dr. Ara, and I have every confidence that our health unit will look into it. Thank you.
Thanks, Helen Claire. All right, I don't see any other hands, so I will just say, Cihr, thank you very much for your presentation. We're well aware and how important health promotion and these programs are, so that we reach our youth as early as possible. So, and prevent disease and health issues later on in life. Dr. Aaron.
Thank you, Madam Chair. I just want to echo your thanks to Cihr. It's a very complex program. The schools are considered hubs for multiple functions in the society, and the health aspect of it is complex in itself. Cihr is doing an amazing job putting it all together and delivering it nicely to improve the health of our communities. Thank you.
Thank you, Cihr. All right, so we'll move on the agenda, and we have item 9, and that is the medical officer of health update, Dr. Aaron.
Thank you, Madam Chair. If I can ask Kaylee to turn the camera up, which probably the quality of the voice will increase. Thank you. So the update, Madam Chair, has 3 components. The first one is verbal related to COVID and vaccine, and we remain in good standing. There has been some increase in the number of cases in cases in a hospital, minor increase and not unexpected. It is completely predicted transmission as the weather changes and people go back to indoors a bit more. And there has been an increase in the variant B4, B5 from Omicron that was detected in Toronto a few weeks ago. So it has a bit more transmission, but there is no change in the direction or the requirement to increase measures related to public health. And the second and third ones, I'm going to be sharing my screen. The second one is related announcement from the Minister of Health in AMO related to funding to public health in 2023. In the announcement, there is good news, approximately 47 million in 23 for public health units and municipalities to ensure the financial stability. There was not specific details about whether this is going to go to mitigation of the 30/70 change in fund or an increase. Nevertheless, it is good news. The second one is continuation of the funding related to COVID-19. And again, there's not details whether it's related to vaccine, COVID response, or both. But we'll keep the board updated as we receive these details. The second aspect is related to recovery and the direction of the health unit with the strategic plan that we presented to the board in March of this year, with the Northern Star of Center of Excellence for Rural Public Health. The organization currently has this matrix organization. The two columns here are the operation programs, and they're led by Dr. Cihr and two senior managers who are Cihr and Andy related to these programs. And there is multiple functions between the senior managers and the program managers. Senior managers are working managers as well. They lead programs, but they also provide mentoring and the other aspects of leadership to the rest of the programs. The foundation standard related to the matrix organization supports these programs. So everything here, whether it is communication, the IPAC, health infectious prevention, infectious disease prevention, and the other health equity, for example, those lenses are examined or applied to all programs in operation. And you can see the corporate part of the organization remains the way it was, where we have finance, but we have a senior manager for finance looking after all the funding and the complexity of it and the changes that we might face, whether it's related to modernization or optimization of our operation. The IT and the human resources and privacy. So this is where we envisioned early in the year we're going to be, and we have been achieved this. The work that we wanted to implement HR-wise in about a year and a half has been completed even in 9 months. So that is good news, allows us for a healthier recovery going forward, to be prepared for anything predicted or not predicted, whether it's related to modernization or other proposals of changes of the sector. Having less management at the higher level of the organization will give us more resources at the front line and delivering services. And open to questions as always, Madam Chair.
Thank you, Dr. Era. Are there any questions or comments? And I will ask you just to speak up. Once you stop sharing.
Certainly, I'll stop there.
Okay. Any questions for Dr. Era? Okay, I don't see any. Dr. Era?
Just final words on those items. Special thanks to Dr. Cihr. Her work has been instrumental. Like I've seen good work at different levels of public health, whether it is municipal, provincial, or international, and her work is second to none. This matrix organization, we had a certain probability of success when we apply an intervention, and that probability only increased with her work to become the definitely that we have at this point.
Thank you. The next item on the update is public health modernization, and there is not an update other than when I attended the annual conference. The word transformation has been used in place of modernization. So if you're reading any material from Alpha on their newsletter, you may start seeing the word transformation rather than modernization. So, and the next item, 9.3, this is the opioid situation in Grey Goose, and Dr. Zayed will update us.
Thank you, Madam Chair, through you, Madam Chair. So the update for this week is related to provincial update. So there is, as you know, the COMO work group led by Cihr, and they have 14 public health unit in addition to other partners. The main work is we continue to meet every 2 weeks, and there is a lot of work with this work group. The main highlight is inventory of strategies of evidence-based intervention, and I think working together as public health units with standardized interventions at all levels would be really important, like the 4 pillars, either the prevention, the treatment, the harm reduction, and the enforcement pieces. For specific situation like gaps or focus on the work through public health about the epidemiology of the indicators of success of how we are doing and evaluation of the work, which is really an important piece. So we are working with epidemiology, like epidemiologists through Public Health Ontario, to try to get these indicators also streamlined. Other pieces are important as well, which is the knowledge censuses. So we see how it is important to communicate what we know and what is happening and where we are going to different levels, either stakeholders or the public. So the knowledge censuses, including the risk factors, the protective factors over the life course, is an important piece that we are working on. Streamlining and emphasizing the work of people with lived experience is also a very important focus for that work group. The work of adverse childhood experiences risk during the pandemic, especially during the pandemic, have been really more complex, and applying adverse childhood experience lens to program planning and recovery across the health unit. In addition to that, there is advisory with attendance for every bi-weekly meeting from the Chief Medical Officer of Health Office, the Ministry of Health, Public Health Ontario, and good relation with other partners like Center of Excellence, CPHA, and the Chief Coroner's Office. And that's for the work group. The other subgroup that is led by Grey Goose Health Unit. So we actually now applied for the locally driven collaboration work project, which with Public Health Ontario. And the priority area is understanding the pandemic impacts on mental health, including harm reduction and the prevention in substance use. And this is led by Grey Goose Health Unit in participation of 3 health units, Simcoe, Muskoka, York, and Kingston. So it gives really a good variation of expertise. The other project is the CIHR, the Canadian Institute of Health Research Catalyst Grant. We already applied for that. So the group decided to apply for both projects. We submitted the registration for the CIHR Catalyst Grant, and the nominated principal applicant is Public Health Ontario, with main public health unit, which is Grey Goose Health Unit, and other public health unit as participant, in addition to other key user, information key users organization. So we will have our partners in the community as principal key users or other key users. So it will be really a good experience. And of course, with these 2 projects, there is a lot of experience and knowledge, and it's focused mainly on what is best as what it matters most for intervention. So I can say provincially that we are going through the timeline and the deliverables, and focusing on deliverables is really important. And for that subgroup, it is 1 year where we can assess these deliverables at the end of the year. So by July 2023. The other thing that is important also is medical subscription things that have been discussed and worked on, the medical subscription and non-subscription model for opioid agonists, safe supply community of practice, continued discussion on barriers and environmental scan, evidence-based intervention framework, collaboration with the coroner's office is really getting optimized right now to improve data post-COVID and get more granular data at the municipal level. So that was mostly all health units really requested that from the coroner's office. The other thing is a local update. So as you all know, we had high dose alerts for 3 times, and there was no we are trying now to work more on this high dose alert and see the more it's mainly opioid, no mixing of drugs, and there is more. We want really to work more on more strategy. Some strategies that we are focusing on as well is strategies to help people, more strategy for harm reduction in terms of people not to use consume drugs while they are alone. So focusing on, and this is very important, like a life-saving measure. One of the things also that we are trying to optimize people with lived experience work. The work of the community outreach is really getting more and more, have more and more publicity across the board. And there is a lot of more trust built with time, and they have been functioning since October. And I think there is they are really offering even more services. Like we partner with the vaccine, so there was a lot of people coming to and knowing more about the community outreach. So I know that we put the opioid crisis in our strategic priority, and it is short-term, medium, and long-term. So there are things that is happening short-term, but yeah, it is still a complex problem. And we are working with the counties, we are working with partners, we are engaging partners like I met last week with Keystone, and we are going to do more work for targeting children, youth, and the caregiver. And I echo Helen Claire about male as well as caregiver. So this is something that we are really working on and trying to really accommodate all perspectives in that. It's not easy, and but we are really diligently working on that, and will not yield. And we will have really. We are working on our strategic goals as a timeline and as we determine. Something else, final thing I want to add is we know that there will be still with this alert and overdose, there will be mortality. So we are going to deal with mortality or hospitalization as they deal with cases in the hospital, like we have mortality morbidity committee. So we can address every case with more dissection of its circumstances and how it happened. Is it prescription, non-prescription? What is the situation? And this will inform our direction and our communication with public and stakeholder as well. That's my summary for today. Thank you.
Thank you, Dr. Zayed. Is there any discussion? Any comments? I would just like to comment that I see the opioid situation similar to anti-smoking, that the province is going to have to put out a huge campaign along with every stakeholder that's part of this, and it will be right in the schools from the the first grade. And we had anti-smoking, we had the seatbelt, and now we need opioid use, and not to even touch it from the get-go. So it'll come with all the stakeholders participating, but we gotta get there. So,
Yeah, just one more thing to you, Madam Chair. There is a way of working like community, like as a framework, community focused social determinants of health, quality and performance, and capacity and resources. And that would be the vertical line. Horizontally, we have primary prevention, secondary prevention, and tertiary prevention. So that's a way we are going to frame that work.
right, very good. All right, so that is the update. I need a mover and seconder to receive the MOH updates as presented. So I moved by Brian O'Leary, seconded by Selwyn. All in favor? That is carried. Okay, next on the agenda is corporate services, and we have a financial report for June 2022. And Kim Rutherford is here to highlight that report. Kim?
Through you, Madam Chair, these are the June financial statements. So there was not a significant amount of change in our financial position from May to June. At the end of June, we had a surplus of $329,000. Most of that surplus continues to be in the seniors dental program. And that program is still working hard to utilize that surplus before the end of the year. Similar to previous months, our mandatory programs and COVID programs are fully funded. Our mandatory program, the funding for our mandatory programs is currently covering 1.3 million of our COVID and COVID-19 vaccine costs. So we've only had to utilize about 500,000 in COVID extraordinary funding as of June 30th. And this is a similar amount to what we had at the end of May. And there's also, we have access to additional COVID funding if we need it between now and the end of the year. Looking at our funding and revenues, consistent with previous months, our COVID extraordinary funding is under budget as our costs, mostly in our wages and overtime, have been less than expected. Our VPD team was busy doing vaccine catch-ups in April and June, and those vaccines are reimbursed by the Ministry of Health through our quarterly submissions. So the funding for the vaccine reimbursement was recognized in June, and that shows in the direct from clients line. And we also had to make an interest adjustment between the capital fund and our operating budget in June to better capture the interest earned on the capital fund balance. And you'll see the increase in the interest income on the capital fund statement to reflect that reallocation. On the expense side, our wages and benefits continue to be under budget as we have not required the overtime that we budgeted for. Our building and occupancy costs are on track with our budget. Our operating expenses continue to be mostly under budget. There is no large notable purchases made in June. I have been working closely with each of the program managers, reviewing their budgets and planning spending before year end. So they are actively being looked at, and managers are planning to utilize what they've allocated to their programs. On the capital statement, our facility manager had some windows replaced. Window replacement was identified in our capital reserve fund study as something that was going to be required in the next couple of years. So those repairs align with that forecast. And then a quick update on the Walkerton dental project. The project is moving along. The main focus right now is on finding a location for the clinic. And the team is also currently working on drafting a formal request for proposal to secure a project manager for the construction piece of the project. So it's moving along. For you, Madam Chair, are there any questions?
Thank you, Kim. Are there any questions for Kim? I don't see any, Kim.
It's all good news.
Yes, yes, good report. So I need a mover and seconder. Helen Chair, are you moving? Yes, and moved, second, all in favor? That is carried. Very good. Thank you, thanks, Tim. Okay, so other on the agenda, item 11.1. This is the 2022 Healthy Communities Conference on September 28th. Dr. Era, you can highlight that, please.
Thank you, Madam Chair, and as Brian here mentioned, it's good news meeting the Health and Community Conference takes place every 4 years as a larger conference. We are during the pandemic, we didn't have this conferences. It will be an excellent event to explore activities and initiatives, studies related to fostering sustainable communities, and there's a number of colleges showing and other showcase their case studies and their studies related to this initiative. The sessions will have some of them as presentation, other as interactive sessions. We encourage everybody to attend. The chair, as usual, will be open. We'll have the opening remark for the conference. Look forward to seeing you.
Very good. So if you can, mark your calendar, September 28th. It is a good conference. We always, the speakers are very good and you learn a lot of information from this. So, all right. So that is the last item on the agenda, except for adjournment. So I need a mover and seconder to adjourn at 11:14. And I have Al Barfoot and Brian Millen, all in favor of adjournment. That is carried, and our next meeting is Friday, September 23rd at 10 a.m. Thank you, everyone.
Thank you all.
everyone.
Cheers.
Good weekend, everyone.
You too. Yeah.
That was great.